So, hi there. Phone's ringing. I thought I turned that off. I'm Tony Berrient, and I am the president of the Hearing Loss Association of America, Mission Viejo chapter. And today is Tuesday, November the 9th, and we'll be having a presentation. And hopefully, as a result of that, you will learn what you can do to hear better in noise. I'm going to ask Alan Katsura. He's our technical person. So Alan, can you let yourself, where are you? If you have any technical difficulties, send him a chat message, and he's going to show you how to use chat. So, Alan, I'm going to share my screen. And I'm going to make control to, all right, all this technical stuff here.
It was up toward the top. It was about 5 down.
There you go. Okay, so Alan is going to give you, talk to you a little bit about using Zoom, and I'm going to get my hands off. And when after the last Zoom instruction slide, I'll take it back. So.
Good morning, everyone. The directions here will be for viewing Zoom on a desktop computer or laptop.
Hold on a second. Let me just do something so that people can get their way in. Okay, there you go. Go.
Okay. If you're using a mobile device, the instructions will be different, and we will not review that at this time. So the first thing we're going to do is go for how you turn on the closed captions, or as Zoom calls it, live transcribe. On the lower menu bar, you'll see where it says CC, and if you click on that, a pop-up menu comes up, and you click on Show Subtitles, and that will give you the subtitles. And on your desktops, you can grab the subtitle box using your mouse, and you could drag it to any location on the screen. You can also enlarge the font size of the subtitles by going to Subtitle Settings. And you also have the option of viewing a full transcript. The full transcript will give you all the captions for the meeting, and they're searchable, and you can scroll through them. And it's not advancing.
Do you need my help?
Oh, I see. Okay. I already went through the caption size font, or changing the font size here. Okay, we have the chat function available for everyone to use today. You can use it for chatting with your friends in the meeting, putting a question in there, or if you're having difficulty using Zoom, you can put your questions in there, and I will attempt to help you with your issues. To access a chat window, it's in your bottom menu toolbar. So click on Chat. The window will open up. You have the option of having the window free floating, or you can dock it to the side of your screen if you're not in full screen mode. By clicking on the 3 dots in the lower right corner and selecting dock meeting window. Because of the number of people we have in the meeting today, it is difficult to see everybody on a single screen. And so we ask you to use the raise hand feature under reactions that is in the menu bar. Clicking on reactions, you'll see the large raised hand icon on the bottom of the screen there. When you click on that, a hand will appear in your thumbnail and also in the participants window. And it also orders the people in the order in which they raise their hands, so we know who went first and who is coming up next.
Thank you, Ellen. Okay, I think it's important to mention that we have a sponsor for our program. We have a couple of sponsors. Mundell-Noel is a sponsor. She is the audiology advisor for the chapter. We also have Caption Call, pays for our captioning services. Joe is here from Chicago, and she's captioning for us in real time. So it's important for you to know, and Amtify is going to be discussing their product today, and the chapter and HLAA does not endorse any single product or service. So, but we do want to bring information to you so that you can decide for yourself, and so that's what we're about today. So just so you know, we're not promoting any particular service. So this is Caption Call. I do talk about it a lot. I used to work for Caption Call, but that's long gone. So I left Caption Call in 2014. But we do want to thank them. They do provide captioning where you need it, when you need it, whether it be on a landline phone, an iPhone, or an iPad. So you can contact them and they'll get you set up. Their telephone number is 877-557-2227. And because life is calling. Okay. The chapter is part of the Hearing Loss Association of America, and the headquarters is located in Rockville, Maryland. We are a 501c3 chapter, which means any donations you make are tax deductible to the extent you and your CPA agree. So we are all volunteer. I have a treasurer, Jeff Chess, I think he's here. Hi, Jeff. And Judy, secretary. I don't know if Judy's here today, but Judy is our secretary. Nobody receives any compensation of any kind. We depend on your donations to support the chapter. I am the president. That's my contact information. So if you don't have it, there it is. I'm Tony at HLAAMV.org.
a.m., 11 in the morning.
Okay. We are going to get right into our program. And Anne Mundell-Noel and Laura Hunt are audiologists at Amazing Hearing. Audiology advisors for the chapter. And Anne is the one who is going to introduce us to Amtify and introduce the presenters who are from Amtify, the best person to really drill down on what is available. So Anne, I'd like, you can unmute yourself, and would you please introduce our presenters, make your comments and introduce the presenters. Thank you.
Thank you, Tony. Yes, I am excited to present to you two women who have really made an impact into oral rehab or hearing therapy. As an audiologist, normally Dr. Laura Hunt would be with me, but she's feeling a little bit under the weather today. So she's listening in, but I'm going to do the presenting of our speakers. But I want you to know, as audiologists, we understand that hearing loss has many impacts on the physical, emotional, and psychological aspects of your life. It affects all parts of you, whether or not you are home by yourself or in a group. And we know that with hearing loss, there is the ability to utilize hearing aids, cochlear implants, and accessories in order to improve comprehension and understanding. Yet, for many people, especially the ones who are here on this call, you need more than what the hearing aid or the cochlear implant is providing you. And so the part that has been very lax and kind of waning in our industry is the need for hearing therapy. We know that if we give the brain the cleanest, clearest signal with a hearing aid or a cochlear implant, that makes huge strides in improving the overall communication. Yet, for many of you, that's not enough. So today, I am pleased to announce a new hearing therapy program called Amtify. And I have Susie, Fages, and Michele Puglisi, sorry, I had to get that Italian name out there, who are going to explain the program. And they have been around with this program for many years, and it's been modified, and I have done a lot of research, and I am 2 feet in with this program. We are going to be an advocate for it because we understand that you need support that you're not necessarily getting from your family and your friends when it comes to hearing loss. So without further ado, I'd like to introduce you to Susie and Michele, and let them take it away and explain what's happening with the program.
Thank you, Anne. I appreciate that warm welcome. Today, we have planned slides that will explain to you a little bit more about what we mean by oral rehab and hearing therapy. We're proud to have a comprehensive program that really touches on many of the most important components. Historically, when people like yourselves will gather, the process of oral rehab is often very successful in a group environment. So meetings of people with hearing loss, perhaps with a group leader, and during that time, we would work on strategies to improve communication, to support each other through those situations that are difficult, et cetera, et cetera. Our goal at Amtify is to provide you with a virtual program, a program that is on the computer that mimics the support and the comprehensive nature of a program that you would receive in person. So Susie, I think that we can get those slides going.
Share? Yep.
Mm-hmm.
Okay. There we go. All right, are we seeing that?
Yes, we are.
Okay.
So Amtify is hearing health reimagined. To tell you a little bit about us, both Susie and myself, we are both audiologists, veteran clinicians for many years. each with our individual passion for counseling and oral rehab. And we feel very lucky to be a part of a company that has a similar philosophy to, to maximize, optimize the lives, the quality of life of people with hearing loss. So Susie leads our clinical account department, the liaison with clinicians like Anne, and I lead the hearing health coaching. One of our components, as I'll discuss in a few minutes, is that you have a person, when you join Amtify and go through our program, there is an audiologist who is your hearing health coach to you and the members of your group. And so we really are providing real life support from an audiologist as you are learning. So if you have any questions, if you are brainstorming or troubleshooting, if you have any tech issues, that hearing health coach is going to be there for you. And that's my gig. Go ahead.
Yep. Hang on. Didn't go. There we go.
So I thought that we would begin by looking at this list that I'm sure you all feel intimately connected to, because people who have significant hearing loss, even when they are, that's okay, even when they are appropriately fit with hearing aids, cochlear implants, and accessories, may still experience loss of some sound. You know, there may still be sounds that are inaccessible to you with your hearing aids on. And we know that significant hearing loss results in clarity issues as well. So even when the hearing aids are working properly, you may struggle to understand speech. And of course, everyone knows that that is exacerbated when there is background noise or poor acoustics. You may, because of the difference between your ears or the type of technology you use, have difficulty finding sounds in your environment. And that results, you know, that poor speech discrimination and inability to find sounds results in really a lot of energy, extra energy that you all put out to try and keep up with what you're hearing, to try and understand. So that increased perceptual effort is really a big deal for people with hearing loss. And we are shooting at Amtify to give you the strategies that you need so that you can relax more and just be in the moment of your social interactions and enjoy yourself without exerting so much energy that you feel more tired than perhaps your peers with normal hearing. Towards that end, we intend to try and improve those stilted or stinted conversations that often comes when there's communication breakdowns as a result of the hearing loss. And you know, we aim to improve the smoothness of communication. Go ahead. I like this slide because it helps to organize your hearing health journey. A person typically will be diagnosed with hearing loss. They suspect hearing loss. They go to an audiologist who tests their hearing and provides them with that diagnosis, and then creates a treatment plan. And that treatment plan is comprehensive. It almost always includes appropriate amplification or other hearing instrument recommendations, sometimes a referral for cochlear implant, and also usually includes at least a suggestion of some extra device besides the hearing aids or cochlear implants that may assist for specific situations. An example, a very common example, would be a system for the TV or a remote microphone. Included in that component is often some introductory informational counseling about the hearing loss, its functional impact, how the hearing aids will help, or the extra technology will help. But oftentimes the informational counseling is limited, and what we aim to provide is that third component. The third component really dives into the patient learning how to better manage their hearing loss in their real life, using their listening devices, but also using a toolbox of strategies. We hope that our rehabilitation really penetrates into a person's daily life. For example, we have daily lessons that are included in Amtify. Susie will talk a little bit more detail about this later. But we have a full week of lessons related to how you can manipulate your environment to improve your odds of hearing better. And some of you, I'm sure because you guys are experts, you're HLAA members, so I know you probably have some foundational knowledge about this. But a whole week of lessons related to tips about, for example, seating, for choosing your seat for different types of situations, to maximize visual cues and to maximize hearing. Tips and strategies about outdoor meetings as compared to indoor. Or, when you're in a restaurant, how to pick your best seat. I mean, we really dive in to the nitty gritty, and that's just 1 week of a 12-week curriculum, each week having a different topic. And that's just the lesson part of Amtify. There are actually other components to the program. So I talked briefly about communication strategies. There's also training related to assertiveness. Oftentimes people with hearing loss are exhausted at having to tell people over and over again that they have a hearing loss. But we spend a whole week discussing conversational styles. I like to often reference my former patients and my family members with hearing loss. And I had a really cranky Uncle Joe who had significant hearing loss from military noise exposure. And he was a meanie, even with his hearing aids on, related to communicating about what he needed for a better understanding. Conversely, I have had many patients who avoid social situations because they are embarrassed to, explain their hearing loss, and it's just easier to stay home. So I'm going to finish with this slide by saying we recognize at Amtify that the persistent effort that is necessary to advocate for yourself can be exhausting, and people with significant hearing loss may be tempted to remove themselves from situations, to detach, to stay home, to isolate. The pandemic has only exacerbated that with the burden of masks and loss of visual cues. And our goal is to really teach ways to move beyond that, because we know that social isolation really does lead to other, physical and emotional complications. Okay, I think we can move on. And so what we are going to do now is I'm going to pass off to Susie. Susie is going to dive more specifically into each of the components of Amtify. And I may talk a little bit more about our coaching. But Susie, you go ahead, you can take over.
Thank you. Thank you, Anne Michele. Thank you, Anne. Thank you, Tony. Thank you, everybody, for having us today and being with us. So as Anne Michele was describing, really the reason for Amptify and how it was created, we're trying to make a solution for people with hearing impairment to have access to oral rehabilitation. And if there's anything that the pandemic has shown us too, is that we need to find alternate ways to get some of our healthcare. In the past, there are some practices that offer group oral rehabilitation classes, and that's not always accessible for everyone, or they may not have their clinician offer those services. So Amptify was really born out of necessity in creating a product and a platform to get out to the patients at large, really. And we want to help you optimize your listening skills so you can communicate with more confidence. So Amtify, or Amtify, you'll also see it written as Amtify DTX. D is in dog, T as in Tom, X, like TX means therapy or therapeutic. So I'm going to probably educate you on a new term that's starting to come about called a digital therapeutic. Digital therapeutics are a type of therapy that is designed to be coupled with some type of digital technology. So some of you may be familiar with diabetes management through an app on your phone. There's weight loss apps. There's even ways that you can access psychologists. So more and more of this digital therapy or digital therapeutic is going to be emerging in all facets of healthcare. We are the world's first for hearing health. So that's where you'll see DTX. But what we're doing is combining, if you have hearing devices, whether it be an implant or hearing aids, and Amptify is even appropriate for patients that don't yet have hearing aids or have auditory processing issues. So we're coupling the treatment for the hearing along with the therapy. So think of it also as you might ask, okay, I've got a hearing aid. I already have an implant. Why do I need therapy? You might think of it along the same lines as somebody going to get a new knee or a new elbow with your orthopedic surgeon. Of course, your surgeon is going to say, and you need therapy. So what we want to help you do is maximize the potential of those hearing aids, of your cochlear implant, by providing the therapy and the auditory exercises, auditory training for your ears and your brain, okay? So here's an example of what Amtify will look like. There's 4 components, and it's very flexible, and you see them on cell phone screens. So it can be accessed by your cell phone, and it can be an iPhone or an Android. You can access it on a tablet or an iPad. And if you don't have or don't prefer to use any of those mobile devices, you can access Amptify on your desktop or laptop. But the most wonderful part, well, not the most, because there's many wonderful things about Amptify, is the flexibility and the accessibility. It being available on a phone or a tablet, you can use it anywhere. You know, people don't leave their house without their phones. And now, luckily, things are starting to open up and you are getting out more, but we're also waiting more. So while you're waiting to pick up your kids or your grandkids in the carpool line, we've all been sitting and waiting in the doctor's waiting rooms. So even if your day is very busy, your phone is with you, you can take a few minutes and get into your Amptify lessons and your games. So again, it's accessible, it's flexible. You can fit it into your schedule however you like. Okay, so again, you're not tied to a specific time of day or time of week, and literally, truly, you can get it into however it works for you. So there's 4 components in the Amptify DTX program. The first one, if you look at that first screen, is a personal hearing health coach. And this happens to be the founder of the company. Her name is Dr. Nancy Ty Murray. She's based out of Washington University in St. Louis, and her many, many years of research is what has helped to create the Amptify program. There's also, so it is a clinically backed, this is a research and clinically validated and based program. We also have an interactive hearing health curriculum, auditory training games, and a peer support community. And we are going to go into detail into those. So I'm going to toss this back to Michele as the Director of Hearing Health Coaches, because she is fantastic at it. So I'm going to give that back to her for a moment.
Thank you. When you enroll in Amptify DTX, you are assigned a hearing health coach who is an audiologist and has been trained specifically to foster good communication and a relationship virtually through our program. We as coaches communicate with you through a feature. It's just a little tab in the DTX called Chat. So just like Zoom has a chat, Amtify has a chat where you can send, for instance, me a direct message that tells me about you, that asks questions. If you need guidance of any type, you can reach out to me. But really, my job as the coach is to reach out to you to make sure that you're on track, that you feel supported, that your questions are answered. In addition to direct one-on-one conversation, in the 3rd week of your program, you join a group. That group is, and I think, Susie will probably talk a little bit more about that, but the group is really where you get to interact with other people who have hearing loss, who are at the same point as you in the Amptify DTX program. And the coach is the one who monitors the group. So for instance, as a coach, in addition to chatting privately, I'm also posting to the group, little tidbits that support what you're learning in the lessons, or conversation starters intended for people to share about what works for them. And so the coach really has both of those responsibilities. And I think I think one more thing I do want to say about the coaching is that included in the Amptify DTX program is periodic assessments of how well you're doing. So the coaches have access to data related to your activity levels and your scores. For example, when you're playing the games, I might review your scores and see that you're struggling with a game, and I might reach out to you to ask if you need any help. On occasion, I will make telephone calls, and we have also begun the process of potentially having video calls for those situations that really warrant that face-to-face communication. But in general, another responsibility of the coach is to keep an eye on you and keep you accountable and active and participating to the highest level possible.
Thank you. So, and Michele touched a little bit on these daily hearing health lessons. And I believe at the beginning, she mentioned it's a 12-week program. So stretched out over 12 weeks is a good bit of information, but it's meant to be in small pieces, small chunks, so you're not overwhelmed. And then also having it spread out, we reintroduce certain concepts, certain strategies as review, because really the ultimate goal is for you as a patient to take these lessons, practice them, learn how to apply them, so they're in your subconscious everyday lives. So when you do go out to a restaurant, when you do get in a group setting, you can retrieve those strategies that you learned and apply them subconsciously. That's the best thing that we can help you do for yourselves. So by about 6 days a week, you're going to log into the app and you will have this interactive content. And again, we're providing you with the tools. We're arming you with tools in your toolbox. Again, you've got these hearing aids. Now we're trying to teach you how to utilize them and maximize the potential of what they can do for you. And we're trying to also help you empower yourselves and create confidence in those difficult listening situations so you can enjoy your lives more. Throughout the lessons, you'll notice there's little quizzes, nothing you have to study for. They're not hard. It's just reiterating the concepts that you've been learning. You're not getting graded. If you do get a question wrong, it's going to give you that right answer. So then again, you can learn how to correct that and apply that to your everyday. Another component, so we've talked about the interactive curriculum, the daily lessons, and the hearing health coach. The other very large component are auditory brain training games. And I know that there's lots of things out there. We all want to exercise our brains and keep them working, right? So these video games, as I mentioned before, this whole program and platform is designed based on clinical research. So these are not just games that somebody developed sitting in their living room, like some of the apps out there. This is specifically designed for hearing impaired patients to be able to strengthen their auditory system. So we did, and to do it in a fun way. The games are fun. They're helping with listening skills, cognitive skills, and again, this interactive auditory training. And then, so what the program is doing is you're going to log in, you'll read your lessons, takes about 5 to 7 minutes a day. Again, fit it in your day when you can. And then you're going to take about another 5 to 10 minutes to play the games. Again, whenever you can. And if you miss a day, that's okay. You can back up, you can repeat, you can go back for reference. Again, this is your program, but you can spend as little or as much time. You could play your games all day long. There's no limit. And there are many games. There's 13 games to choose from. They are also adaptive, so it's not the same old game every day. You can choose from multiple talkers, so you can practice listening to a male voice, female voice, children, which I know a lot of you probably have grandchildren, and that's what everybody says as an audiologist. People say, come and tell us, I want to hear my grandkids better. Well, we want to help you do that too. So you can practice with the child's voice and also British and Australian accents. So we also hear a lot, everybody wants to hear Downton Abbey better or Bridgerton, and they have a hard time understanding those British TV shows that are so fun to watch. So this is going to give you practice in listening to that as well. You're also going to earn coins. So it's like earning points. So when you play the games, when you read your lessons, you'll earn coins for participation. And then within that group community, there's a leaderboard. So then, some friendly competition happens in there too.
Susie,
and again, yes.
Could you just go back one sec, because I wanted to just take a moment related to the games, because oftentimes, I mean, I'm going to take a guess that most of you have never done any formal auditory training. You might know that you need to understand better in background noise, or you may recognize that when somebody tells you a long-winded story, it's hard to keep up and then remember the whole thing. but you probably have not done any formal practice for those skills. So the skills that these games are designed to work on are in fact directly related to improving your speech discrimination in the presence of background noise. They are designed to improve your auditory memory. There's a game like the old children's games, Simon's Ear, where you have to remember the pattern, and the pattern grows in length with each correct answer. And there are games specifically designed, it's not listed here, but to work on the endings of words. So we all know that sometimes that like that plural S is really tricky because it's a high frequency or a high pitched consonant that is often, difficult to access even with hearing aids. So there are games specifically designed for you to work on plural S. And by gamifying it, by not just making it a rote exercise, by gamifying it, we're intending to make it fun. So it's not a burden to play. It's just, part of your daily and fun, and you get some coins, and maybe you make it to the top of the leaderboard. So I just wanted to, qualify that a little bit. Go ahead.
Thank you. And again, we've touched on the peer support community. So again, it's being like taking that group AR that may have happened in person, but just moving it to this app platform. But by having it there, we're helping you build a community. You're sharing experiences. We know that we all learn from each other. It's also really helpful with a hearing loss to know you're not alone, that there's other people dealing with the same struggles. But also by being in this group, you can share strategies. So what works for somebody, you may want to share that. And even if you're not participating and posting your own chats, you can read some of the strategies that other patients have used that's been helpful to them. So we want to, help you counteract social isolation and keep you in a place that's comfortable and a place of understanding and acceptance. And Amptify is backed, and like I said before, by clinical research and peer-reviewed publishing. And for some of the research that we have had these certain outcomes where we've had enhanced speech discrimination. Like Michele said, it's teaching you to listen and practice listening and learning between similar sounding words. It's helping to reduce that perceptual effort, as she talked about at the beginning. We want to enhance your hearing wellness experience. We've really had some good outcomes and good feedback with patients having improved listening confidence.
Susie?
Yes.
I'm sorry.
No, go for it.
But I just wanted to jump in only because I have the daily experience of being with participants, and the participants, for example, I had a lovely post in the final week of lessons. One of the group posts is just related to looking back and discussing how Amptify has helped. And I had a lovely post from a woman who talked about how her husband, because she was able to verbalize what her needs were in a communication environment, because she was learning about it, and she was able to tell her husband what she needed. The husband was learning, and as a result, the husband was like actively, for example, turning the TV down before he tried to get her attention to ask her something. Things that he was never doing before, but because she was able to highlight it directly and specifically talk to him about it, the communication between them had improved, that it was noticeable enough for her to write a group comment about it. And so, enhanced hearing wellness experience really does translate to, relationships and quality of life increased participation in, conversations with important people. Go ahead.
And I would like to just add on to that, as far as this group has experienced some of that community, because Tony has done such a great job with the Hearing Well Club and the Mission Viejo Hearing Loss Association group, but this will just enhance it. It's not to replace it, it's to enhance it and to just give you more tools in your toolbox. This is also not to replace your audiologist, as far as myself or whoever you're going to see. This is to complement it and to give you more resources and tools. And because it is app-based, meaning it's on your phone or on your computer, you can access it at any time that you want. So you're not logged in to certain time frames. So I just want to kind of reiterate that.
Mm-hmm.
Thank you. And I'll jump into, and that was a nice segue from Michele about the improved communication and interactions between couples. Over the years, I've heard from many, and I've worked with many patients and couples, and seen the frustration between, a husband and wife, and the person with the hearing loss feels like the person, their spouse, doesn't know how to help them with their needs, and they're accusing each other. He doesn't talk loud enough. She's talking from 2 rooms away. Well, she has hearing aids on. She should hear me, So there's a lot of misunderstanding and assumptions about what a hearing aid can do and what the far reach. No, you're not going to hear somebody 3 rooms away upstairs, even if you have your hearing aids on. So there's so much rich information in these lessons. And I actually recommend that the communication partner or spouses, even your children or parents, read the lessons too, because it's just going to really help and enhance everybody's communication. And truly, it's all strategies that, even if you don't have hearing loss, it helps communication, period. So that's been a very strong outcome as well. We did also have, if you see the bottom of the screen here, our most recent study had new hearing aid users with Amptify, and 96% of the people in the program said they benefited from the program. So that's huge. Obviously, you cannot get much better than 96% in an outcome like that. And when they rated what they liked best, they actually rated the lessons in first place and then the games in second. So that again shows you how rich that information is and how valuable it is. Even if you're a long-time hearing aid user or a cochlear implant user, and you think you know what you need to do, there's so much information. There's practical examples. I'm sure there's lots of things that you haven't thought about, or different types of strategies. There's even breathing techniques and helping you create confidence for those difficult situations. How many of you stopped ordering in a restaurant or even going to a restaurant because it's too difficult to understand what the waiter is saying? You've stopped going to parties. We want you to live your life. So we are trying to arm you with the information to be able to do that.
Susie, I think Tony wants to ask you a question.
Yes, I can't see everybody. So yes, ma'am.
Yes, we have a couple of people that have questions. Is this
okay?
Time?
Great.
Yeah, sure. Because you know what, we just have these couple testimonials, and I'll leave it up there, and people can read it, and I can answer the other questions. How about that?
Okay, so Winnie, you want to? You are unmuted. Okay.
Yeah. I have a question. When you're talking about the games, do you have anything that deals with when people talk? They get very soft sometimes at the end of their sentences or the end of their words, and I'm always missing that. Do you have anything in the program that deals with that?
I don't believe there's anything specific where the volume is dropping off, but there are a lot that have noise in the background. But I think just the notion of you training and listening on a daily basis and focusing and learning to strengthen your auditory system should transfer into you being more focused on them. And Michele, you can piggyback here on that.
Right. I think the closest direct link to your complaint would be related to bound morphemes, which is those word endings. So there are a couple of games that can be performed in quiet, so there's no background noise, but the purpose of this study is to work on the endings of words. And when people's voices drop off at the end, although a significant component of that issue for you is a loss of audibility, for what remains audible, our intention is for us to work on clearing up those endings, if that makes sense.
Okay, and what did you used a word at the beginning of it, but I didn't hear that word. I'm sorry.
That's okay. I think bound morphemes.
Bound.
That's just morphemes. Yeah, that's just the fancy word for word endings like ing and ed and s.
Okay.
Yes.
Yeah, that's and sentences too. Sometimes it might be a word or two even at the end of the sentence, and it's the important. They always. And like actors, when you go on the just performances, they get real soft in the most important parts that you want to hear. It drives me nuts.
I know. Just last night, I was at an event next to one of my friends with hearing aids, and she complained about just that exact. It was the heart of the story. We were listening to a lecturer. It was the heart of the story, and her voice got almost to a whisper.
Exactly.
And she missed it. I know.
Thank you.
Thank you, Winnie.
You're welcome. Thanks, Tony.
Now we have another question here from Tony in Michigan.
Thank you. The question I have is related to the program itself. I'm familiar with LACE. I have used that, and I'm sure you're all familiar with it. But the problem I had with that was when my computer crashed, they wouldn't let me reinstall it on another computer. So it sounds like Amtify is available on all different types of platforms, computer. So will I have that same issue with Amtify if I crash a computer? I'm not going to be able to access it.
Well, I hope that doesn't happen to you again. But no, and you can use your you'll be creating a login and a password, and you can use that across devices. So if one day you wanted to use your phone and then the next your computer, you'll be able to pick up as well where you left off.
Right, because Tony, I think the difference is that, one of the main ways that people got LACE was to buy the CDs. And you would literally install it onto your computer. But this program on your computer is web-based. So you're just going to app.amptify.com on your internet browser. We recommend Chrome primarily, but other web browsers as well. So when you go to the web and you log in, you'll be brought to where you are in that program. So there's nothing to install, bottom line.
Thank you.
Do we have any other questions waiting?
I do. Just to piggyback on that, LACE did have a web-based program. And the problem with LACE, because we were strong advocates for LACE, because we really feel oral rehab or hearing therapy is necessary for everyone, even those without hearing loss who are struggling. LACE, the problem with that is that you did 11 sessions in 14 days, and then you had to kind of get tested again to see if there was a change. What I love about Amtify from an audiologist point of view is that you will go through the 12-week program, but after that, if you sign up through Amazing Hearing, you have access to all the resources and the games unlimited. So you would, Tony, be able to come back on, even if you had finished your program, and be able to do all the games, which is really what excites me about this program.
Correct. I would say that is that you hit the nail on the head there, Anne, about the value of signing up through Amazing Hearing. Because when you sign up through a clinic, you have continued access to training indefinitely beyond that 12 weeks. So you are maintaining, it's like, continuing to go to the gym. You don't just go to the gym for 12 weeks. You continue to go to the gym to maintain those skills.
Great.
Mike?
We have another question. Oh, did you want to add something, Susie?
Oh, no, I was saying I saw Mike up at the top of the screen there, has his hand up.
Okay, so we have Mike Quinlan from Texas.
Yes, my question is related to costs. What is the cost of the application? Do you have to pay for your cost for the audiology coach? Are some of these costs reimbursable by insurance?
Let me see. Let me check where we are because I think we have a. Let's see. Yep. Yeah. I might throw that one back to Anne.
Yes.
Because right now, and then we can go backwards. But if you're interested in signing up with Amptify, and you can do it through Amazing Hearing, and you can call their office. But I'm going to let Anne take over and answer how she wants to pass that information along.
Sure. So I want you to know that the 12-week program, whether or not you sign up through Amptify directly or you sign up through an audiology group that's working with Amptify, such as our office, the cost is $150 for the 12-week program. So it's $50 a month for 3 months. And then at the end of that 12 weeks, if you signed up with an audiology group, such as Amazing Hearing, we will allow you to stay on indefinitely. There's not going to be another charge. You pay the $150 up front. You do the 12-week program. When you're ready to start, you would contact us and we would get you going, and then you can stay on for whatever length of time you want to. If you sign up directly through Amptify and you don't come through an audiology provider such as us, after the 12 weeks, you will then pay the $50 a month to maintain the membership. So there's no reason that you wouldn't want to sign up through an audiology group such as ours. We are the same cost as Amptify for the 12-week program. It's just that because we have more people, they are going to allow us to let you have unlimited access to the games and resources. Is that accurate, Susie?
Essentially, yes. So yeah, not every clinic is going to have that kind of program accessible. So by going through, like she said, an Amazing Hearing, the way that their clinic is signed up is to allow you to then have unlimited access to the games once you've completed the 12-week program. If you were to do it on your own, again, it would be $150 for the 12 weeks. But if you wanted to continue, then you would be paying out of pocket each month until you decide to discontinue the logins, basically.
Yeah, it's definitely the better value to.
Yeah, for sure. It's a very generous program, and you're very lucky to be able to have access to it through Anne's practice.
And the reason that we are offering that, we're kind of subsidizing it, is because we just feel so strongly about the need for oral rehab, about the need for connection and community, and doing what we can to give you the most for your hearing.
Okay, next question. We're going to go to Dale in the East Bay.
Hi. You talked about the program being clinical research based. Are those studies available to us? And
Sure.
how would we access that?
We have a citation document. Did we include that slide or no? Oh, that's right. It's on the website.
It's on the end. Oh, there we go.
So these are the citations directly related to the games, and in fact, in the portal that Amazing Hearing can access under resources is an updated version of this citation page, where that it includes our most recent studies that were either like in print at the time of this. Or later. So I'm wondering how we might be able to get that to them. I could pass it on to somebody.
Probably get it to Tony. Should we get it to Tony?
That's a good idea. Sure.
Tony, is that okay with you?
Yeah.
Were any of these studies, were they sponsored by Amptify?
No. These studies were completed within the WashU Research Center. As Susie mentioned, Nancy Ty-Murray, who is a co-founder of Amtify, has really spent 20 years with her partner, Brent Spears, working on the validity of the auditory training games. So the majority of these studies were actually completed before Amtify was formed.
And if anybody's familiar with CLEAR, has anybody heard of the CLEAR program? It was really the predecessor. I know you have, Ann, and I obviously can't see all 40 of everybody right now. But CLEAR was a predecessor, and the initial research, so some of this might have even been from CLEAR times, but CLEAR was just the auditory training games. And based on the feedback from the clinicians and the patients, that's how Amptify was created, with the further need for the hearing health coach and the curriculum, as well as the peer community. So Amptify is newer, but the research was also based on our previous product.
Thank you.
You're welcome.
Okay, Rich, I'm going to ask you to, unmute yourself. Thank you.
Okay, my question has to do with the timing. I'm in the process of being evaluated at UCSF for a cochlear implant. Should I wait until I get an implant, or should I go ahead and sign up and train, because currently I'm deaf in the right ear?
So I think the recommendation has been that for you to begin training before your implant would have benefit, because you will be sort of armed with the information from the lessons as you go through your implantation process, but then you'll also have a baseline from which to compare your improvement post-activation. So our recommendation is to get going beforehand, and then, follow through with us as you are adapting to implanted sound quality.
Thank you.
You're welcome.
Okay, one more question. This is from Gail Olson. Gail, would you unmute yourself?
Okay, hi, everybody. Let me just say that this is really what my loving companion and I have been waiting for. So it's like amazing that this is going to happen. I'm just saying he's at the point, it's not really for me as much, he's at the point where he doesn't even want to go to noise, even want to attend. He knows his social skills are poor, but this is a way he can get it. He keeps thinking it's his new hearing aid. He got a fabulous new hearing aid, and he's going like this. There's just no way he's going to be able. There's still some obstacles when you get a hearing aid. And noise is one of the biggest obstacles, and it can't give you that. But I was wondering, where does he go? Where would we go to? Is this online, one-on-one, when you mention that? Only online? It doesn't go to the audiologist's office and take this 12-week.
What you'll do, and when it's time for you to register, you would contact Amazing Hearing, and they're going to give you a code, and you can, like I said, you could log in and just log in daily online on a computer. You can also, if you have a cell phone or a tablet, you can download the Amtify app onto your phone or onto your tablet, and then you would log in and play the games and do the lessons on there. Or you can do any combination of device.
So Susie, I just want to add to that so that people have it very clear. When you call Amazing Hearing and you tell them that you want to sign up for Amptify, you would pay $150 and we would give you a code. When you get your code, you can choose at when you want to sign up and get started with the program. If you want to do it right away, if you sign up, you get put into a group the following Monday. Is that accurate?
That is.
If you want to hold on and not sign up and wait till after the holidays, you can do it then. So just know that the first step is calling the office, paying the $150, getting the code, and then it's up to you as to when you want to start that program. But we are here. Dr. Laura Hunt in our office is going to oversee the program, and we are here to support you through our office as well. But all the therapy, all the work is going to be done through Amtify. So they are the ones who you will be interacting with and asking your questions with. Amazing Hearing is here in the background to kind of help you get started, but all Amptify questions are going to go to Amtify, if that makes sense.
Correct. And you know, what we're talking about here regarding the timing of starting does sort of play off of a question that was placed in the chat, which was, can the 12-week program be spread out over a longer period of time? So the way that the program is set up right now, every day a new lesson is released for you to view, regardless of whether you've viewed the previous lesson. But built in is like a little back arrow on the day, near the day of the week, that allows you to go back to missed lessons. So for instance, maybe you were sick for a few days or you went away for the weekend. There, you know that there's 3 lessons waiting for you. When you log in, you're going to see today's lesson, but you do, using that back arrow, have access to go and view those previous lessons. And so what we have, or what, you know, as a coach, I've directed very often is, you know, the flexibility is there for you to chunk your doing of the program. If you have to, you can sit down and do 3 lessons at a time and train for a half hour. Or if you wanted to just do the lessons through the week and then on the weekends catch up on all of your training, you can do that too. In fact, there was a study, one of those citations, that showed that there was no difference in improvement, or very, very little difference in improvement, between those that trained daily for a set amount of time as compared to those who chunked the same amount of time total, but together. So there really is that flexibility, if you need it, to end up extending the program by a little bit longer than 12 weeks. And because if you sign up through Amazing Hearing, you will have continued access to those games and to the lessons beyond the 12 weeks. You will, you know, be able to, if you've sort of run over, if you know what I mean, like if you have more to catch up on it and you've hit the 12-week mark, you'll have access to that information.
So what you're saying is the resources and that material will stay online and they can go back and access old lessons if they want to recap
Correct.
or whatever. Okay.
Correct, Anne. Yeah, there was some variability with that in the early stages of Amtify, but we have solidified that part.
So with LACE, it was important for you to do the 11 sessions in 14 days. Have you gone through this and shown that if they do it every, 6 days a week through the 12 weeks, it's better than doing it long term over a 3 or 4 month, or has that not been assessed?
So there is a study related to whether skills were maintained beyond the 12-week mark without training, because I think there was like a follow-up in one of the studies at either 3 or 6 months. And not surprisingly, what we were happy about there was that the majority of skills were maintained without continued training, but that those people who continued to train saw further improvements.
And when you're talking about continue to train, are you referring to playing the games?
Yes, I'm sorry. Yes, I am.
I think there's another chat here. What is I think it's the therapy with an audiologist. What does it contain? So you're going to be doing your lessons and you're going to be playing your auditory training games, your interaction with the coach, and Michele is the expert here on this one, but she's going to be checking in with you and overseeing your progress. At the beginning, you'll have check-ins, and I'm going to let you jump in here because this is your department, but that's really the direct contact that you have. And then I think we were going to be adding a therapy session or an interactive session at the beginning of the training.
Right. We hope to include that in the coming months. We're working on it. Yeah. Because I think that it will be helpful if at the beginning of the program, there was a quick one-on-one. So you could see that I was a real person and I could see who you were as a real person. And we could sort of orient you briefly to the program face-to-face through a virtual meeting. But yeah, so the therapy part, when we talk about therapy, we're using it broadly to encompass the content of the lessons, the auditory training. The coach within Amtify is not directly providing therapy because it's the other components that are providing the therapy, but the coach is there as a motivator and a person to support you in that process. So, at its very most basic, you might, have trouble understanding the directions to a game, and I'm there to explain it to you. But, I've had people say, I'm heading to a wedding over the weekend, and I'm concerned about how I'm going to hear people. Can we talk through what we should do? And so through some, question and answers, I'm able to provide some individualized, customized recommendations for them. It's really in the brainstorming process and in, directing them from the general content to how to specifically apply the general content to their lives that I'm involved.
Okay. Another question. Mohammed, you had your hand up. Did you have a question?
No, actually you answered it. Thank you.
Great.
Okay. And Winnie?
Yes, I was wondering, it's a question for Anne. I'm not a patient yet of Amazing Hearing. So if I'm not, can I still call you to get the Amtify?
By all means. Anyone on this call, anyone that you know, We are just a supporter for the program, and so anyone can sign up, and you would be working with the Amptify coach. So we would strongly encourage it. We also are going to include this in our Thanksgiving letter to those who are patients of mine. We will have a little insert in the Thanksgiving letter to let you know about the program because we feel so strongly about it. And it's a great gift. Give it to somebody that you know this holiday, that you could just type up something to say, I'm going to give you something that is going to last through the year, and give them the gift of hearing therapy.
That's a good idea, Ann. Thank you. And I was wondering, as for Tony, is there any way that somebody that wasn't here today, because I have a couple of deaf friends, if they could access this video to hear this?
Absolutely. Yes. Yes. And I'll be sending out, as soon as it's available, I will send it out first to everybody that's registered. They'll get a notice as soon as it's available. And then I process this and I actually upload it to YouTube, and it'll go out in an email in a week or so.
Okay, thank you. Because I think everybody should hear about it. Sounds like a great program, you guys. Thank you.
Thank you.
Thank you.
You're welcome.
I've signed up.
Yay!
I haven't started yet, but I signed up. I wanted to hear today's presentation before I, got involved. And already I've discovered I've lost my password. So I fixed my password. So I'm in the process of resetting that.
You can reset it with the
Yeah.
forgot password link, just like on any other website. And we're all forgetting passwords every day. So you're in good company.
You're not alone. I'm very adept at maneuvering members through the forgot password process.
You're in good company, Tony.
The last thing that I would like to bring up is we've had somebody else who tried to sign up and thought that their cell phone was not strong enough or more up to date enough to handle the Amtify app. And so can you just briefly talk about the difference between how the app and the computer, what the requirements are? I know you said you can go back and forth between the two, but could you just address that very quickly?
I think Laura emailed me last time we were looking into it. She said, she asked me about iOS 11, and iOS 11 is fine. I did confirm that. We're looking to see just how far back it can go, but a few things to consider, kind of just like when you're putting those hearing aid apps on and trying to connect to your phone. We're still a little bit at the mercy of the phone. Oftentimes just shutting it down and restarting it helps wonders. So when all else fails, that's a troubleshooting tip. Shut it down and restart it. But
Susie,
you should.
I'm just going to check knowledge base here. I just want to see if it's documented in here. Hold on.
Okay. I know Chris was checking on something else, but he said at least, 11, iOS 11 was fine.
Got it.
But, and like Anne Michele mentioned before, if you're on a desktop or a laptop, we do recommend you go through Chrome every once in a while. I think on somebody going through Safari, there's been little glitches. But in those kinds of issues, if you were to have any, that's the perfect time to chat the coach. And there's a way to do that through the app or the website where you can ask the coach, and that would be mostly Anne Michele, could be me. Or if you put in a support ticket to care@amtify.com, we're going to help you work through those issues. So if you ever have a glitch or there's something and you get stuck, we can certainly help you troubleshoot that with our tech support. But again, shutting down and restarting works wonders. So
two things just to add to that. What would be their expected turnaround time to get a response from you? Because obviously you have a life. And then the second thing is just to remind people that if their hearing aids connect directly to their iPhone or their Android, they would be able to play those auditory games right into their ears. And that there's times during the therapy that they ask you not to do that so that you have a different experience. But just as a reminder that they could play games all day long and not bother your spouse near you.
That's correct.
That's right.
That is correct.
It's a 24-hour turnaround. Oh, sorry. Did you respond exactly at the same time?
I said within 24 hours, and usually less. We try to get back to you pretty quickly. Does that help?
Okay, I think we're clear of questions. Last chance if anybody has a question.
Well, the last thing that I would like to just kind of clarify is, yes, you would sign up through Amazing Hearing to get the code, yet the majority of your issues that you might have or questions are going to go through Amptify. My staff is swamped with regular business, so although we would love to support you, I really am going to encourage you to continue through Amtify for Amtify issues.
That's right. And on our website, on our website is a telephone number that you can call. So say you have your join code and you can't even log in to send me a chat because you've run into a problem. You will be able to reach a member of the Amtify team through a telephone number to get you started. You don't even need to call Amazing Hearing about that.
Hi, Dale.
Hi. Are there other audiologist groups that Amptify works with?
Yes, there are. There are some clinics. Actually, why don't you take the lead on that, since that's
that's okay.
Right?
So we're launching throughout the country. I can't say off the top of my head if we have somebody in your immediate area. Certainly, you can look into it, or ask if you have a different audiologist. But for this particular program and promotion that Anne's practice is offering, certainly you could go through her. Patients can sign up for Amtify without an audiologist too. So it is available widespread. But again, you get this terrific offer through Anne's practice today.
Yeah, the first thing you might want to do is just contact your own audiologist and say, are you, connected with Amptify? And if they're not, maybe they could contact Amptify and get connected.
Well, I'm with Kaiser Hospital, and that would be a huge undertaking to figure out who to contact.
Yeah, and you don't have to do that again, and it doesn't have to necessarily be connected with your audiologist. Again, you can sign up for Amtify even on your own, so it's just available for you here.
Okay,
so we are totally just a pass-through. So it's no benefit to Amazing Hearing. So again, if you sign up privately through Amtify, it's $150 for 12 weeks and then $50 a month after that. If you sign up through Amazing Hearing, it's $150 for 12 weeks and then you get unlimited service after that, or unlimited access. So again,
that seems like quite a benefit.
Yeah, and it is, but again, that's just our love for oral rehab and hearing therapy, but we are just a pass-through. It's just trying to give access so anybody around the country could sign up. They don't have to have your own audiologist be that group, but you certainly can.
Thanks, Anne.
And we're by no means, nobody's trying to take you from your audiologist or anything. You stay with who you're comfortable with. It's just a supplement to your hearing health care.
Okay, I guess we're going to wrap it up. we're going to wrap it up. And it is just about 12:30. So thank you so much, and Michele, and Susie, and
Thank you.
of course, Dan. You're always there for us, and thank you very much. It's really been great. I'm excited about starting. I'll probably get on it right away.
Great.
So anybody who signs up, maybe we can be on at the same time, and I can send you messages. Wouldn't that be kind of neat?
Oh, yeah.
That would be.
Yeah, whoever signs up by Sunday night would be in the group starting Monday.
That's
together.
right. Mm-hmm.
Here's the last question for you. So do people who are signing up and they're in the same area, do they find each other in the app?
So if the grouping currently is based on timing of your sign up. So just like Susie said, for those people, regardless of where you are or where you're coming from, your location physically, for those that sign up by Sunday afternoon, by Sunday afternoon, will be placed together in the group that begins on Monday morning. But you won't know who's in your group until week 3, when the group opens up. The first couple of weeks, there's no group content because we really want to get you established in your habit of logging in. You do have immediate access to the coach to directly chat with, and I get you started. But then in week 3, the group would open up, and then you'd see all of your friends.
Interesting. So the people that'll be in my group, they'll be in my group through the 12-week period?
That's right.
Interesting. Okay.
Yes.
All right. Well, thank you, ladies. Thank you. It's really been very enjoyable. And I look forward to doing oral rehab really for the very first time. After all these years, I've never done it. So I'm looking forward to really hunkering down. Yeah.
Look forward to having you. Thank you.
And thank you all for coming. And we have another meeting next month on December the 14th. And what that meeting is going to be about is going to be a surprise. So thank you all for coming. Bye.
Thank you.
Bye. Thank you.
Thank you.